So before I come in the room, I would prepare my medication, and I'm preparing my medication using the 6 rights of medication administration. So right patient, right medication, right dose, right route, right time, right documentation, and also for the right reason. And I'm checking my medication 3 times before I give it. My first check is going to be just verifying the order and the medication. My second check would be in the med room against the MAR, and that would be using the 6 rights of medication administration. I'm gonna draw it up in the med room. I'm gonna check it for the expiration dates, any allergies my patient may have, and I'm also gonna do any drug calculations that I may need to do before giving it. And I also want to know any the action of the medication, any special nursing considerations, what reason my patient is getting this medication, and the appropriateness for them to get it. Also going to know any adverse reactions that they may have, and also I want to know the safe dosage range for that medication. Also, I would never draw up more than 1 patient's medication at a time. I would only draw up and give 1 patient's medication at a time before going to the next patient. So I'm going to knock, enter the room, provide for privacy, identify myself, and greet my patient and the parent if appropriate. I'm going to identify my patient using their name and date of birth and perform hand hygiene. I'm going to use any special considerations for the pediatric population that are needed. I would provide a safe environment with minimal distractions for my patient. I'm going to any information or teaching that I give would be appropriate for the parent or the patient if their age is appropriate. And I would restrain my patient if needed as appropriately during the giving the medication. Also, when I give my medication, I would use the right technique and the right route when I give it. So I perform hand hygiene. I'm going to put on my gloves. I would have 2 gloves in this scenario. So I'm going to prepare my patient. And the first medication I'm going to give is a IM injection. You give this at a 90-degree angle in the vastus lateralis of the patient's thigh. So I would open my alcohol swab, and I'm going to turn my patient as appropriate. And I'm going to clean their leg. I would uncap my needle, and I'm going to give my medication. I would engage my safety and put a Band-Aid on their leg, and then I would never lay that down. I would put that immediately into the sharps container. And then my second medication is a sub-Q. I would get a new alcohol swab, and I'm going to give this one in the fatty tissue of the anterior thigh. So I'm going to clean their leg. And this one is going to go in at a 45-degree angle. So I would uncap my needle. I'm going to give that at I'm going to pinch the fat tissue and then give that at a 45-degree angle. And then engage my safety, put a Band-Aid on their leg, and dispose of that in the sharps. And I would never leave a medication in the room after giving it, or any needles without disposing of them. I'm going to stay with my patient to look for any adverse reactions after giving the medication, and I'm going to document immediately and as appropriately as possible.